Welcome to clinical monitoring with percent baseline mode. Monitoring patients in percent baseline is meant to be used for pediatric cases below 35 kilograms who did not start their monitoring while on a ventilator or in other very specific cases. To review the placement of the disposable pad set, you should recall the following. The application of the pad set is meant for clean, dry, intact skin. Routine skin prep using alcohol or other skin prep solution is recommended prior to placing the pad set on the patient. It is also recommended that if you would require shaving or clipping the patient for EKG electrodes, you follow your facility policy and perform this accordingly. For easy placement, there are three anatomic landmarks: A, the sternal notch, B, the xiphoid, and C, the mid-axillary line at the level of the xiphoid. The pad set is designed to help placement on the right side of the patient's chest at a 90-degree angle. Remember, once connected to your patient by using the pad set tail with the black connector and the white patient cable from the ExSpiron, confirm you have a good quality respiratory trace visualized in the top window of the screen. Displayed here are two examples of acceptable respiratory traces. The upper trace displays a regular breathing pattern without drift or movement. The second and bottom trace shows irregular but normal breathing and is also an acceptable trace. These are two examples of poor respiratory traces. If you have a poor respiratory trace, make sure your patient is calm, not moving, and is not talking. Do not proceed with monitoring until there is a good trace in the window. In the top trace example, you notice a small drift, which may resolve itself. The bottom trace likely is indicating erratic breathing, and you may have to coach the patient to be calm and relax during the baseline collection. If the trace is still poor, proceed to troubleshoot, starting with the pad set placement, and verify the electrodes are making good contact with the patient's skin. If you need to remove the pad set to prep the skin again or clip hair, discard the old pad set and place a new, unused one. You might also check the connections between the pad set and the white patient cable and the patient cable and the back of the ExSpiron monitor. Now that you have a normal respiratory trace displayed, ensure that the patient is awake, relaxed, and breathing normally. Begin by selecting Start with percent baseline from the taskbar on the right side of the monitor screen. The ExSpiron will immediately begin collecting the patient's current baseline minutes ventilation. Once you touch Start percent baseline monitoring, the ExSpiron collects the patient's baseline breathing for 30 seconds. The idea of the baseline is to collect the patient's normal breathing pattern while they are at rest. It is important that this collection be done when there are no other activities during the time frame. No one should be touching the patient, and the patient is not moving around or talking. It is usually best just to observe the patient and begin the percent baseline during a quiet time. If they are talking or animated, you may need to ask the patient to be still for a moment or think happy thoughts while you take the measurement. But it is best not to say breathe normal, because they usually begin thinking about their breathing and it won't be normal at all. If the patient is obtunded and appear to be breathing shallowly, you may want to wake them for the baseline, or you may want to try collecting it regardless. You should do your best to either awaken or calm the patient to achieve what you consider to be normal breathing. If you cannot do this, please note carefully that the patient was either agitated or somnolent according to your charting guidelines. The default alarm screen will be displayed while the ExSpiron collects the baseline in the background. This default alarm setting for low minute ventilation is at 40% of the patient's baseline. This is the alarm zone that you learned about in the general overview module. Alarm settings can be customized to ensure you follow your facility policy on low and high minute ventilation alarms. To set the high minute ventilation alarm, touch the icon beneath high MV in the column and touch the on-off so it is highlighted in blue and reads on. You will also need to adjust the value to setting recommended by your facility. In this example, it has been set to 300%. Once you have confirmed the desired alarm settings, occasionally, after baseline collection, you may get an alert that the collected baseline is either high or low. This message occurs when the collected baseline minute ventilation is outside of the predicted minute ventilation values based on the patient data you entered during the setup. If this occurs, always check that the patient's height, weight, and birth gender are entered correctly in the patient data screen. A low baseline may indicate hypoventilation when the baseline was collected. The patient may have already been sedated, be asleep, or obtunded. A high baseline may indicate hyperventilation as the patient may be anxious, restless, or in pain. You might consider a second collection of the patient's baseline. While similar looking, the percent baseline mode shows minute ventilation displayed in percent compared to the breathing at the time the baseline was collected. So, it provides a trend to tell you if your patient's respiratory status has changed since that time. Just as in other monitoring modes, the graph continues to show you when the patient is at risk for hypoventilation or hyperventilation. Remember, the ExSpiron will only alarm if your patient baseline falls below 40% or rises above 300% for a sustained period. Please note that the alarms will be set based on your specific hospital policy, but may be adjusted based on patient condition at the time of baseline collection. ExSpiron alarms are accurate and actionable. Use of the ExSpiron can lead to reduced alarm fatigue for clinicians. When the ExSpiron alarms, it is actionable and there are very few false alarms. The alarm condition will also be highlighted in a message bar along the top of the screen. When you see a low minute ventilation alarm, it is an indicator of hypoventilation and requires a patient assessment. Clinicians may consider interventions ranging from arousal, stimulation, repositioning the patient, opioid dose modification, opioid reversal agents, airway maneuvers, placing the patient on CPAP, BiPAP, or high-flow oxygenation, and even consider reintubation if appropriate. If you see a high minute ventilation alarm, it is an indicator of hyperventilation and requires a patient assessment as well. Clinicians may increase support by high-flow nasal cannula or BiPAP therapy, pharmaceutical or other therapies, or intubation if appropriate. To pause for toileting hygiene or ending a patient session, touch End Monitoring and select Yes. You have now paused the current monitoring session. If you are completely through with monitoring this patient, you can also touch the button that says Close Patient and simply power off the ExSpiron. Monitoring with the ExSpiron Minute Ventilation Monitoring System is really that simple. You can rest assured that while you're managing your other patients during your busy shift, the ExSpiron will be there to silently monitor your patient's respiratory status and alert you at the start of respiratory decline. It allows you to take early action and avoid the need to rescue.